in progress.
Welcome, everyone. Thank you for joining us this afternoon. I'm Eve Feinberg, founder and director of the Chicago Coalition for Family Building, and I will be your host of today's webinar, How to Apply for a Family Building Grant. I'm so excited that you can join us and hope that we collectively at the Coalition can help with your family planning needs. Today's webinar will focus on our family building grant, what it actually means, and how to apply for it. I'm joined today by several members of our amazing team at the Chicago Coalition for Family Building. First, I want to introduce Dr. Jennifer Hirschfeld-Citrin, who's our vice president of this organization.
Hi, everyone. So glad you're here.
Jill Smiley, who's one of our directors.
Hi, everyone.
And Elise Heisler, who's one of our phenomenal volunteers.
Hi, everybody.
Before we get started, I want to go over just a few housekeeping items so you know how to participate in today's event. As you're tuning in, do not worry. Your microphone is muted and your video is off, so you don't have to worry about any settings on your end. We did that largely because of anonymity and to respect people's privacy. At any time during the webinar, you may use the chat function to make a comment. Just make sure to select all panelists and all participants so that everyone can see what you have to say. There'll be time for Q&A at the end of the discussion. To submit your questions, use the Q&A function. You can submit questions at any time, but we won't answer them until the end of the discussion. And don't worry, if you miss anything or you want to share this with a friend, this webinar will be recorded and will be sent to you after the event. At the Chicago Coalition for Family Building, we strongly believe that everyone who wants to start a family deserves the chance to build their family. Since our founding, we've been fortunate enough to help bring over 74 babies into this world. But there are so many of you struggling out there with infertility issues, and we are here to help you. Today's webinar addresses our grant application process, which opens on April 23rd, which is the start of National Infertility Awareness Week. We have a lot of grants to choose from, and we know that the system can be tough to navigate. I think the most popular questions that people ask is, am I eligible? What are the different grants? What is covered by the grant? Lots of questions for sure, but fear not, we will answer them all. I'd like to welcome our panelists and let them introduce themselves. Dr. Hirschfeld-Citrin.
Hi, my name is Jenny Hirschfeld-Citrin. I am the proud vice president of the organization. I help lead our medical advisory board that reviews applications so that we can choose applicants with really optimal opportunity of success, optimal chance of success. So very excited to be here.
Jill.
Hi, I'm Jill, and I manage the recipients once they've been selected throughout the grant year.
Dr. Heisler.
Hi, everybody. I'm Elise. I am an OB/GYN resident, previously living in Chicago, now in New York, but still very active in the Chicago Coalition. My job is kind of to be the medical liaison. So once you're paired with a partner practice, which I'll talk about in a little bit, help navigate that pathway, as well as I'm usually the ones that are responding to emails. So if you hear from me, that's who you're talking to.
So Jenny, first and foremost, can you explain what the different types of grants are?
Yes, absolutely. So in the context of our grants, I think the biggest piece to ask yourself is, what is it that I'm applying for? So if somebody is applying for an IVF cycle, which they themselves will be potentially the egg source, or their partner potentially would be the sperm source, and what we think of as a traditional IVF cycle, then you would apply for a grant for donated services, an IVF cycle grant. If you are someone who's going to need third-party reproduction, meaning egg donor or sperm donor, embryo donor, or gestational carrier, then you should be applying for a financial grant. Specifically, we have a couple other grants for certain patients. So if somebody is a BRCA carrier, then they can apply for our Magnolia Tree grant, unique to that patient population to help prevent passing that on to future generations. If there are those that are who identify as a part of the Jewish community, they can also apply for the JUF grant. But the biggest thing to decipher for most is, am I applying for financial or am I applying for an IVF cycle grant? You should ask yourself, what is it that I'm hoping to obtain from this grant? Is it an IVF cycle for me and my partner? Please apply for the IVF cycle. If it's egg donor or sperm donor or gestational carrier, please apply for a financial grant. I hope that's helpful.
Yeah, and I think it's really important to note that patients can only apply for one type of grant, not multiple grants. And so if you apply for one type of a grant and we actually think that you're more suitable for another type of a grant, for example, if you apply for an IVF cycle grant, you have to have no insurance coverage because the IVF cycle grants are given by partner practices. And if you have insurance coverage for infertility, that's really not the express purpose of that grant. But if you need additional financial assistance, then we will move you over to a financial assistance grant. Same thing holds for the reverse. If you apply for a financial assistance grant, but really what you need is an IVF cycle and you don't have insurance coverage, then we may move you over to get a donated IVF cycle. So now that we know the grants available, let's talk a little bit more about eligibility to apply and who is eligible. Jill, can you take the lead on this?
Yes, so the basics are that you need to be 41 years or younger. Your BMI needs to be less than 40. Your FSH needs to be less than 15, and your AMH needs to be greater than 0.5. And this is if you're using your own eggs. If you're using donor egg or you're using a surrogate, the data would be more pertinent to the person that you're using. If you're using the JUF grant, then you need to live in the Chicagoland area. But for our other grants, you can be in Illinois, Indiana, Missouri, Wisconsin, or Iowa. But you need to understand you need to be within close distance to Illinois because your treatments will need to take place in Illinois. That's where we're able to reimburse with our funds. You do need a diagnosis of infertility in some cases, but you can also apply if you're single, if you're a same-sex couple, if you carry a certain genetic disease that requires IVF. You can also apply for egg freezing if there's a medical indication such as cancer or severe endometriosis. And then also we do review your tax return because income is taken into consideration when we are evaluating the applicants.
Excellent. Thank you, Jill. I will also say that we have an excellent FAQ page on our website. So if there's a question that Jill didn't answer, I would encourage you to also review that FAQ on the website if you have additional questions, or feel free to drop those into the Q&A if you're watching this webinar live. So once you've established you're eligible to apply, let's talk a little bit about what you actually need to do. Elise, can you tell us a little bit about what the application process looks like?
Definitely. So we have a wonderful application that is through Kaleidoscope, which you'll be able to access from our website starting on April 23rd. The application itself is pretty straightforward. It asks you some questions about your personal life, about your financial situation, and of course about your infertility. And it has you select one of the grants that Dr. Hirschfeld-Citrin talked about, and then add additional information depending on which grant you applied for. Now, in the past, we used to have a physician recommendation form that was required. And this year it's a little different. So we will have you upload your own medical information, and that includes things like AMH, FSH, estradiol. We'll ask for a uterine cavity evaluation. So if you had an HSG or an SIS, and if you don't know what those are, that's okay. We're happy to answer those questions, or you can see them on our website. But basically all your medical information that will give us the best picture and insight into your fertility. And then we'll have you send a recommendation form, if you're able to your doctor, who can corroborate that information and give us a recommendation based on kind of your whole picture, so that we can talk face-to-face with them about what we think would be the best grant for you. We'll also have you upload a copy of your medical forms, a copy of your tax return, and other things to confirm your residence in Illinois or the surrounding Midwestern states. And all of that is kind of bundled into this wonderful application that should be very straightforward for all of you to access.
Yeah, and I just want to add, there is a small application fee of $30, and that basically covers, we're a nonprofit organization. The application fee has an annual fee that we pay for, and we offset the cost of that in part by charging a small application fee per applicant. So we're going to talk a little bit about, Dr. Herfeldt-Cintron is going to talk a little bit about the Medical Advisory Board and how, once you've completed your application, how those applications get scored.
So once people complete, we have two ways that we consider applications. For those individual using their own egg or their partner's egg, we look at those parameters like Elise just described, like your AMH and FSH, and a score is generated. Similar for the sperm source and similar for the uterine source. And that's a way to sort of, in a sense, rank those that would be most likely to obtain success from our grants. And of course, we wish we could give every single person a grant, but we just don't have the reality of those funds. So we do really mindfully want to give grants with those with the greatest likelihood of success. In addition, you have an opportunity to share with us your story and share with us how you would give back to the foundation. And that really does matter. So it's helpful for us in those essays to hear more about what brings you to our organization, to hear how you could help us grow and build. So from what you're hearing here, everything that we fundraise for, we gift back to our patients and those that are recipients. And so our ability to have a wider net on those that we help, a wider reach, really starts with more people helping. And so sharing your story is something that we will want. Having creative ways to work with us and fundraise with us is just really important. So we love to hear everything you have and all of your ideas. It really does make a difference. So thank you for filling out the applications with so much time and consideration.
Yeah, and while we understand that infertility can be painful and private, part of the mission of our organization is to break down the stigma of infertility. And we do require that every grant recipient puts a photo on the website, a couple photo. We actually don't include your last name, but we do include your first name with a brief bio. And if that is something that makes you uncomfortable, then unfortunately, this may not be the right grant for you. That is probably one thing in this that is just simply not negotiable. If you're not comfortable sharing your story and you want to remain private, there are other grant processes that are within the US that don't necessarily have that same requirement. We feel very strongly about wanting to share our outcomes with our donors. We've actually published in the academic medical literature on the success of the grant program. We really pride ourselves on having full transparency and where the money that gets donated gets spent, and we carefully track each and every one of our recipients until the final outcome, which we hope is live birth. And so in addition to, once you are accepted for the grant, in addition to sharing your story and your bio, we ask, and this is where you communicate with Jill in regards to your fertility journey, we ask that every month or every quarter you send an update on where you are in your treatment cycle, what's been done, and then the outcome of your hopefully your IVF cycle or IUI leads to live birth. And then we do collect outcomes, and we do use our social media channels to share live birth stories, baby pictures. Again, we're very mindful of not putting your full name and your last name and any identifying information on the internet, but we really feel like it's very important to share your story. So let's talk a little bit more about what's covered by the grant and what's not covered and how money is dispersed. Jill, I'm going to ask you to take the lead on this.
Okay, so for the IVF grant, basically you're receiving a donated IVF cycle from the practice. So this isn't going to cover medications because those come from a pharmacy. Those don't come from the actual practice itself. And if you need to freeze your eggs for the IVF cycle, that's also not covered. It would be a fresh transfer. So you would have to pay extra if you do a frozen transfer. And part of the reason we don't cover the egg freezing is that really the goal for this grant is to achieve pregnancy within the first year. So all of the costs covered are pertinent to that, which is why we don't cover egg freezing. Now, if you're a financial recipient, you can use the funds that you receive for medications. And there's, we still wouldn't cover the egg freezing with the exception of JUF, which can be a little bit different. So I encourage you, if you're looking at the JUF grant, to go to their website to specifically look at the differences.
Yeah, one additional point is the grant funding has to be used within a 12-month cycle. So typically grants are awarded in either August or September, and then you have a full 12 months to use the grant money. Whatever grant money is not used by that 12-month mark will roll over into the next pool of applicants for the next calendar year. And if you need an extension due to extenuating circumstances, you just need to communicate that to us. And there have been certain situations where we've been able to grant an exception. Elise, I'm gonna have you talk a little bit about the IVF grants and how that works with getting paired with a partner practice. And also what's included in the donated IVF cycle.
Sure. So we are lucky enough to partner with a number of the IVF practices across the Chicagoland area. And when you receive an IVF cycle grant, as Jill said, you're receiving kind of the whole thing start to finish, with the exception of a number of pieces, which we will talk about. And it's important to keep in mind that you might not get paired at the partner practice that you currently belong at. We do our best to match you with the doctor that you're currently seeing, because we think continuity of care is really important. But unfortunately, we don't, have enough grants with each practice to pair every single person with their the practice that they're currently at. So you have to know in the back of your head, you might be paired at a different practice. In terms of what's included, it's all professional medical fees for the patient's pre-cycle physical exam, ovulation monitoring, including ultrasound and lab work, egg retrieval, laboratory services, and fresh embryo transfer, as Jill said. Medications are not included. Occasionally in the past, we've had additional grants that are able to help cover the medications, but I can't say for sure that that will be the case this year again, but I hope. Things that it excludes are any ultrasounds or pre-cycle labs before. Those are kind of required for your application. Anesthesia for egg retrieval, any genetic carrier screening. If you're looking to do pre-implantation genetic testing, that is not covered. But again, in the past, we've had other grants that maybe can be used to cover that. Cryopreservation or storage fees are not included. Frozen embryo transfer, as I said, is not included, as well as early pregnancy monitoring.
And also, one of the biggest things to remember here too is that we do not reimburse previous fees. So if you're applying for the grant, we're not going to reimburse you for fertility treatments you've already had. And even once you have the grant, we still can't reimburse you directly. We can only reimburse the healthcare provider. So if there's one takeaway from today, it's that never pay a bill that you're counting on us to help you with.
Yeah, so when you do get a bill, what we have you do, and we'll give you much more, the recipients will get much more clear instruction once awarded the grant, but we ask that you have your healthcare provider either provide you the bill and then you forward that to us, or oftentimes they will, they have relationships with our chief financial officer in our organization, and they know who to call to get that bill paid. And that's a really important point, specifically for tax purposes, that you don't actually receive the money in hand. And so we do take care of all of those bills on your behalf. So I want to dive in and talk a little bit about the timeline of the grant in terms of the application, the deadline, the announcement, and what to expect. Jenny, can you take over for this?
Yes. So in the context of the deadline, the goal of setting a deadline so we have enough time to review our applications and get back to you in a timely fashion. So as mentioned, this opens for April 23rd, the beginning of Infertility Awareness Week. It ends on June 1st. Shortly thereafter, these applications are sent to our medical advisory board. They have the opportunity over the course of 3 to 4 weeks to score based on that scoring system that we discussed prior. And then after those recommendations are made, our board of directors meets to define the recipients of the grants. That occurs around August. And then our goal always by September is that recipients are notified and those grants can be dispersed. And that coincides September with one of our main fundraisers, which is our race. So we really appreciate all that apply, but we'll require all that our recipients to attend. And this, someone just asked, does this grant timeline include the JUF grant? And yes, all of this will be under that same timeline. Thank you.
So Elise, can you talk a little bit about when and how people are notified and what happens to those patients who are unsuccessful?
So around the time after the medical advisory board has reviewed all the applications and we've had a chance to sit through and, select the finalists, you will get a phone call to the number that you put on your application, letting you know that you have been selected as a recipient for a family building grant. At that time, we'll talk about next steps, but the main things that are important to remember are a contract will be sent to you, which you have to sign, both you and your partner, if you have a partner, and sent back to us. You also will need to send a photo, as Dr. Feinberg mentioned, and a short bio for our website. And feel free to peruse our website right now and look at some examples. And again, that is mandatory, that's required in order to receive a grant. And once you've done those three things, then you have access to either the partner practice that we paired you with or the financial assistance for your adoption grant or your financial assistance grant. And all of that is required before you're able to kind of take those next steps. If you're not selected for a grant, we usually send an email about a week or so later after we've identified our recipients, just in case anybody says no or anybody is not in the right timeline to receive a grant. We can always offer it to runner-ups.
And also, just before you apply for the grant or before you accept the grant, if you're selected, make sure that you really consider your needs before you apply, because once you've accepted the grant, if you later on decline it, we usually do not have enough time to reassign it to someone else. And so you're taking someone else's spot who would have otherwise used the grant. So make sure that you know that you are moving forward with trying to achieve pregnancy within the year of getting the grant so that someone else doesn't miss out that really deserves it.
Yeah, and I just want to reiterate that we are an all-volunteer organization. And we really rely on the generosity of our donors to keep these grants going and to keep the organization afloat. A huge part of how that happens is by sharing those stories and by having complete transparency to break down that stigma of infertility. So I think our mission is really to break down the financial barriers to make sure that every couple is able to have a baby or individual is able to have a baby who wants to have a baby, and also to provide education both to our recipients as well as to the community about infertility. And I think that a huge part of how we do that is by talking about it openly, honestly, transparently, and really getting out there and showing off the amazing work that we're doing at the coalition. And so in addition to receiving a grant, our main fundraising event is the Run for Family Building, which this year is September 24th. So mark your calendars. We do strongly encourage, while we can't mandate that everyone goes, we do strongly encourage participation from all of our present and past grant recipients year after year. And so we do have a fairly good number of patients that come back with their babies, and people join fundraising teams. And aside from raising money for the coalition, it's just a wonderfully heartwarming event that really reminds me as a physician, as a reproductive endocrinologist and infertility specialist, and as the founder and president of this organization, it really reminds me of my why. Why do I do this? Why do we all do what we do? And it's to help. It's really to help break down those barriers for infertility. So, I think that we'll open it up for questions. We have about 15 minutes left for Q&A. I'm going to just take some of these questions that are in the chat and then just start there and go from there. So one of the questions that was asked is, are you able to share an estimate of how many applications you receive in each grant cycle? It's a great question. We receive anywhere from 80 to 100 applications. Not everyone who starts an application completes an application. So sometimes people are going through the application process and they realize that they're not eligible, or maybe they get pregnant as they're going through the application process, or maybe they haven't really completed all the testing that needs to be completed and they're not able to complete the application process. At the end of the day, we probably have about 50 really good, solid candidates, and year over year, we've been able to grant somewhere in the neighborhood. We've grown. We started at 5, and last year we awarded 20. So it's a very good chance if you medically meet the criteria in order to get a grant, and you have a good likelihood of having a baby, you have a really good likelihood of receiving a grant. And I wish we could grant everyone. We're working on that, and that's a huge reason why we do so much fundraising, so that we can expand the number of grants that we're offering. But we really have been able to offer a fairly high number of grants relative to our applicants. Will the website be updated on the 23rd with the application link? Yes, that link will go live. So the application will go live like right on the 23rd. It may not be right at midnight on the 23rd. At some point, sometime during the day on the 23rd, that application will open. It is a Sunday, so we are somewhat relying on a third-party company, which is Kaleidoscope, to make that live. But it should be at some point on the 23rd. We probably should just tell people the 24th. But yes, it will go live. Somebody asked, can this grant be paired with other grants from other organizations? And do you need to know that? If it is a financial grant, no, we don't necessarily. I mean, it would be lovely if you shared it. It wouldn't detract from your application in any way, shape, or form. If we are giving you an IVF cycle grant, a donated services grant, it would be nice to know, because it's not a full financial grant. So it would be nice to know if there's another grant organization that's also helping out. Are there questions that are in a Q&A that I cannot see? Hold on, there's also a Q&A. Will the bios be in the application process, or will that be a separate form to fill out? So the bios are only for the recipient. So you do not need to submit a bio or a photo until you get accepted for the grant. We didn't want to put through everyone to do extra work when it's not needed. Can you use your 2021 tax return if 2022 has not been filed? That's a great question, and I would have to defer to our accountants on that. I'm assuming that's somebody who files quarterly. We would probably want to know what's been filed since your last application, and as much information as you can share with that. Jill, I'm going to have you answer this one. If we are already in the middle of the IVF process, egg retrieval scheduled, and are chosen for the grant, are we able to get reimbursed for the procedure or the PGT that is in the process of being tested while we're waiting for an answer?
We will not cover treatments that were previously received prior to being awarded the grant. So if you receive a bill after you've gotten the phone call saying you've been awarded the grant, then we can pay for it, but we will not be able to cover any sort of process or invoices received before the date that you are awarded the grant.
So yeah, and we can't overstate that. So the grants, whatever date you receive the grant is eligible from that date forward. So let's just use, August 15th as an example. If you're in treatment right now and you're paying out of pocket for that treatment, then that unfortunately is your responsibility. We would cover. So the next question is, if you're planning to do a retrieval soon, but are not ready to do transfer yet, is there a grant that you can apply for? So you could apply for a financial grant that would cover the cost of your embryo transfer, as long as that embryo transfer happened after the grant was awarded. So in the other webinar chat, would my husband and I still be eligible if we already have 3 frozen embryos, but wanted to have more children and are not insured for another round of IVF? So if you're just doing embryo banking, you can apply. I I think that's too general of a question. I would apply for a grant and have the medical advisory board review the whole situation. There definitely are situations if you carry a genetic disease or you want to have 4 children and you need to have a good number of embryos banked. There definitely are situations where that would be covered. So I think it's just a very nuanced question, but I would encourage you to apply for a grant for additional retrieval cycles. For people who need pre-implantation genetic testing for BRCA, is the infertility diagnosis needed? No. And so if you need to do PGT for any reason, be it BRCA, cystic fibrosis, any genetic disease, you can go ahead and apply for a grant. I am just starting this journey. I am unsure what my insurance will cover. I'm unsure what exactly I will need, perhaps before the application is due. I'm unsure, will I actually need assistance? Jenny, can you talk a little bit about that one?
Yeah, so I think this highlights that first and foremost, it is valuable to determine what your coverage is. And so we aren't necessarily benefit experts, but I really encourage each and every person to contact their human resources, to contact their own insurance. That is the definitive voice, so that you can learn what is covered under the current plan that you have, so you can determine what your needs are. I would also identify, if you're not an infertility physician, to see and do some diagnostic testing so you can determine what type of treatment may be needed. So it sounds like potentially meeting with a physician and connecting with your insurance company might be the first next steps before applying.
Does using a sperm donor preclude you from an IVF grant? Not at all. And in fact, on the application process, there's a form to fill out, or there's a box to fill out for sperm parameters. And it specifically says in there, if you are using donor sperm, just mark 1. So you can absolutely apply for a grant with donor sperm. I am just trying to see if we missed any. Is grant preference given to couples over single applicants? Not at all. Any other questions? You guys have a full panel of people to answer every question you might be able to come up with.
And if you think of a question afterwards, remember that this is recorded. You can also go to our website and use our FAQ page, which is very robust. And if you still don't find your answer there, you're always welcome to email our account and we can answer questions that you have.
There
Yep.
is one more question that just showed up that asks if you're doing the retrieval soon, if you can use the IVF grant just for the retrieval. The answer is it depends. If you're just doing it because you're not ready for pregnancy, then no, the grant is not for you. The point of the grant is to achieve pregnancy within the calendar year of the grant. If you're doing it for oncology reasons, or because you have a severe disease such as endometriosis, then yes, then you could apply for a grant for just the retrieval.
So somebody asked, are you disqualified from a grant if your fertility clinic says they will not start treatment for one reason or another? Again, this really speaks to the grant has to be used within 12 months. And so every individual situation will be taken into account. Hemoglobin A1C is a modifiable risk factor, and many people can modify that within a 3-month period of time. So we really look at the whole picture, and it doesn't necessarily mean that you won't get a grant, but we do worry that if the problem is severe enough that you'll run out of time in that 12-month period, and you may be better off waiting another year to apply for the grant. Obviously, a lot of that depends on age, depends on your AMH and your individual factors. But I think just trying to be as transparent as possible when you fill out the application and share as much information about your medical history as you can will help us, and will help. We have 8 board certified fertility physicians on the medical advisory board. It will help the medical advisory board to make sure that that we're doing the right thing medically.
I think there's a
I'll-
question about what the medical advisory board looks for. And so in addition to likely outcome of success, again, is how you as an individual are going to help give back to the foundation and a bit more of what brought you to us. And so there are 2 open-ended essays. I would take those seriously because this is our opportunity to truly learn about your story. And this is also our opportunity to see how you could help us with our mission, which is exactly as Dr. Feinberg had said, to help meet the unmet need for those who are under or uninsured and to help remove the stigma of infertility. And so we're looking for partners in that, and how you could be one of our partners is a way for you to explain it to us in that essay.
Yes, so just about the scoring of the application, about, I think 55% of the application is based on medical prognosis and 45% is based on your personal characteristics, who you are, how you plan to engage with the organization, and how you plan to give back to the organization in the future. And that can be giving back by volunteering your time, by working at the races. It doesn't necessarily have to be a financial contribution, but it has to be an engagement contribution.
Yeah, by no means a financial, but exactly. There are so many ways that people can give, and we're just looking forward to hearing some how you plan to or may be interested in.
I think one of our previous grant recipients runs a peer-to-peer program. So when new grant recipients are selected, she will meet with the new grant recipients, try to pair them up with a buddy to help shepherd new grant recipients through their year of their grant cycle. So just a really beautiful way to give back to the organization and really give back to the infertility community, and try to, I think, just try to women helping women and people helping people and couples helping couples through what arguably can be an isolating and lonely process. We just try to make it a little bit better for everybody. So I think I'm just scrolling back through to see whether or not we have any additional questions. I think we have answered everything. And again, as to what Elise said, there is an email address associated with the coalition. It's grants@coalitionforfamilybuilding.org. Again, we're an all-volunteer organization, so oftentimes we don't answer questions until after the workday is complete at night, very late sometimes. And so be patient. We don't always get back to people within like 5 minutes, but it's usually within 24 to 72 hours. And we look forward to your applications. I want to assure everyone that each application is really reviewed very mindfully, very thoughtfully. We have an incredible team of physicians who 2 physicians review every application in the medical advisory board. Your applications are reviewed by our board, by the committee here, and by our board of directors. And we look forward to your applications. Somebody just commented they missed the first 20 minutes. If we can fill them in. This was recorded, so you'll be able to go back and watch the first 20 minutes. All right, everyone. Thank you very much for joining us, and we look forward to your applications.